All right, guys, welcome back to another Wednesday Doc Talks, and today we're going to be talking about the application of kind of a newer, I shouldn't say newer, it is a technology that is becoming a little bit more popular with rehab and treatment. It's called blood flow restriction training or blood flow restriction recovery. So this is really a cool technology because it can help all of the itises, tendinitis. We have the lateral and medial epicondylitis, Achilles tendinitis, patellar tendinitis, these things that are, these tissues that are irritated that we need to somehow rehab and put some load onto, but we don't want to keep on making them irritated and be kind of progressing in their pain levels. We also can treat pre and post surgeries with this. Meniscus repairs, shoulder repairs, these things can be treated with blood flow restriction training. And then sprains and strains, say you roll an ankle, you bust up your wrist. These things are definitely things that we've had success with in the past with blood flow restriction training. So that is who it can help. Now, why is it helpful?
Yeah, why would we want to do this? Why do we want to do this kind of therapy? Well, as Dr. Booth was saying, let's talk about the itises, those tendons being inflamed. A lot of times if you keep loading that tissue at the same load that you're currently at, that's just going to make it more inflamed, it's just going to aggravate it, and they're just going to be in kind of this repetitive cycle where healing doesn't actually happen. So if you have something then like a sprain and strain, maybe you're on crutches and you can't even, walk around on it, or maybe you get past grade 1 and get into grade 3 again. It's just you can't put body weight on something because it's just either going to make the injury worse, it's just going to make things hurt more, and of course it's just not going to let you get to that healing stage. So we want to do this kind of therapy when you can't load those tissues, whether it's body weight or whether it's specific exercises and activities. If we do this, we can make your body work just as hard, but we do it with a lot less stress, strain, and damage onto those tissues, okay? So blood flow restriction, we do exactly that. So you can see Dr. Booth has thrown some cuffs on him. They kind of look like a blood pressure cuff that you see in a doctor's office, and that's exactly kind of what it is. So we are going to reduce the blood flow to those tissues and still make them work. But when a tissue has to work with less blood, that means it's getting less oxygen, and therefore it is working harder. So this, again, we're not loading him up, we're not getting him doing, a 1 rep max back squat or really any kind of heavy loads. We're gonna have him do lightweight, but again, because he's working without that blood flow or restricted blood flow, less oxygen, we're still getting a therapeutic benefit without causing more damage, stress, strain, irritation to whatever it may be on the bodies.
That kind of tricks the brain, right?
Yeah, it tricks the brain. So if we get into the science part of it, you hit this thing called your anaerobic threshold a lot faster, and that tricks your brain into thinking that you're working just as hard as you would be in the gym, pumping out 80% rep maxes, but again, you're doing it with either no weight or very, very light loads. So we trick your brain into thinking it's working hard when it's really not, just by oxygen deprivation, basically. Yep.
Yeah, you can almost like increase the body's ability to try to heal itself by, like we said, we're tricking the brain, tricking the body. It's really cool technology. They have a lot of sciencey names for all the hormones and stuff that get released. That doesn't really matter. Just know that it's your body kind of getting revved up at a higher rate because it's still getting that load. So
yeah,
that's very, very important.
Yep. So let's just say we have we have a tendonitis at the elbow here, okay? So we know, like, if Dr. Booth were to be loading it, doing something really, really heavy on the gym side, that's just gonna make the tissue more irritated. We're gonna take off that load, again, just restrict the amount of blood getting to those tissues that are working and trick the brain into still working at that high level without the stress and strain on those tissues. So you can see these beautiful cuffs on him. The first thing we do is for each individual, everyone is different, meaning different in their blood pressure that's needed to occlude a percentage of that blood going to the tissue, okay? So the first thing we do here is I take what looks like, a blood pressure cuff. If I'm gonna do Dr. Booth's arms here, okay, so I want to essentially always be doing both sides as well, because you can have different pressure from side to side. It'll usually be pretty close, but you certainly can have different pressure from side to side. So I'm going to attach something that's gonna help me take the pressure in his arm. And then I'm gonna use a Doppler to listen to the blood flow going through his arm. What I then do is I pump, 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 until I no longer hear that blood whooshing through. And it sounds just like that, a whooshing sound. And then once I hear that, I document that number, and then from there, we take a certain percentage of that number. So then going forward, let's say it takes 100 pressure to occlude that blood flow, then I'm just gonna take 50% of it. In the legs, we do the same thing, but I use 80% occlusion. Bigger muscle, we just take a little bit more from that. So after I've pumped him up, I see what his specific pressure number is for exercises. That number stays the same, usually going forward. There's some exceptions to that, but then we can do that number every time. We just pump up, and then we make him work. So let's say I pumped him up in the arm here. He's awfully strong, so we're gonna start off with a little bit of weight here, and then he's gonna go through some curls. But they're gonna seem a lot harder than if he wasn't wearing this cuff, because his muscles are having to pump and work with 50% less oxygen going to them right now.
And so the implement, whatever the weight is or the resistance that the patient is given, is extremely low. So if they could do 15 pounds 100 times, that'd probably be a really good weight for them to start with, because it's gonna be super easy. But like Dr. B was saying, if we take that oxygen away, it's gonna fatigue out very quickly. It's gonna feel like it's 100 pounds that they're curling instead of just being a 15-pound weight.
Yep, so it always is a lot harder to him than what it looks like. Wimpy, he could do a lot more weight than that, but he can't, because it's just so much more difficult restricting that blood flow. So this is one that we like to do with some curls, but if we want to do legs, what I'm gonna have him do, I'm gonna have him do a single leg raise. So he's gonna lay on the table. We did our same stuff here. I pumped him up. I was actually getting kind of the blood reading from his artery down lower in his ankle. He's pumped nice and tight. And then he's gonna go and do some straight leg raises. So if he had like an ankle sprain right now, let's say he's still on crutches, he's not able to put like any weight or minimum weight on his ankle at all, this is not gonna stress and strain those tissues, okay? Those injured tissues are not being aggravated, he's still working those muscles, and then getting good therapy, good growth hormone release to still assist in an injury further down. So, something, again, you could pump out a lot of them. You're probably not going to be able to pump out near as many because of, again, having to work with less oxygen to those muscles.
Very, very good technology to keep people moving. The psychology of an athlete is to never stop training most of the time. If you're one of those athletes that don't want to stop training because you acquired an injury and you think that you have to rest, don't have that mentality, reach out to us and we'll see how we can keep you moving. Blood flow restriction training might be something that will really help you. If you guys have any questions, reach out to us, 702-558-2151, we'll get you some help. See you guys.